Hi everyone, my name's Liz Clayton. I'm one of the staff nurses with the school nursing team in Warsaw. Today I'm going to talk to you regarding the toilet training workshop. So just a bit of information first about the school nursing service. School nurses are qualified nurses who have additional training in child health and wellbeing. We all work within a team. There's staff nurses, nursery nurses, support workers and administration staff. The school nursing team support children and young people from the reception age until their 19th birthday. Young people with disabilities or additional needs can also be supported to the age of 25 years. We provide support and help with lots of range of physical and mental health problems. So how to access our service? We operate a single point of access. We work from Monday to Friday, 9 a.m. till 5 p.m. The following contact details are there that you can contact our service on. We offer confidential advice and support. Our text service, which is the last number, the 075, allows parents to contact us anonymously. So, what is toilet training? Toilet training involves learning to understand the actions, language and routines in learning to use the toilet and developing skills and independence in managing these skills. Your child may have been referred because they've been experiencing problems with developing the skills and independence to use the toilet. They have specific problems with their bladder and their bowel. They have behaviours that affect them using the toilet. We're going to work through these issues as we go through the presentation. So, why is toilet training important? Every child should be supported to reach their full potential, and learning to use the toilet is one of the most important skills that a child can learn. The development of the skill has a large impact on the young person, their family, friends, and the professionals who work with them. It is really important to promote continence. Although majority of us are already toilet trained, problems can be due to an underlying behavioural problem. And as I said, we work through looking at different problems as we progress through the presentation. So, first one that we're going to look at is my child is soiling in their underwear. Some of the reasons this could be happening is that the young person might be fear of using the toilet, a lack of toilet routine, resistance of toilet training, insisting that the nappy is put on so that they can open the bowels, anxiety, emotional upset, or the stool is too hard and painful to pass. Some children might soil their pants, they might soil on the floor or in an inappropriate place. Some young people with additional needs may still not have learnt to wipe themselves properly, so sometimes they can still soil onto their underwear afterwards. If we think about the poo that's inside our bladder, it's like a conveyor belt, and that's how we tried to explain it to you. So the muscles in the bowel push the poo along. So if we think of a conveyor belt in a supermarket, the muscles squeeze and push it along towards the rectum, which is where the poo comes out. Once the poo's inside the rectum, there's a message sent to our brain to say that we need to go to the toilet. Lots of children may experience, as we said, fears of falling into the toilet. They don't like the sensation of the poo coming away from them. They don't like it when it splashes into the water. They don't like the smell. They don't like the texture of having to wipe themselves after. There's lots of things that this can be happening for. So we're just going to talk a little bit about constipation. So constipation is the most common cause of soiling. As you can see here, we've got the human body and constipation. We'll talk through that as we go on. So the bowel, which is where the poo is stored, becomes loaded with large stools that are hard to pass. Sometimes the poo can become so big that it's like a mass formed within the bowel, and then water will just leak around it. And this can be known as overflow. So it's like a runny brown texture. And that can leak around the hard lump of the poo that's there. It can become extremely painful to pass the stool, and some children will withhold it because they don't want it to happen. The messages sent to the brain to tell us we need a poo are caused, as I've said on the previous slide, is when the poo goes into the rectum, that's when the little message comes into our brain. If that poo is sitting inside the rectum all that time, the rectum itself will come actually stretched. So eventually we'll lose those messages being sent to the brain. So it'll just sit there, the rectum will be stretched, and the young person won't know that they need to have a poo. And that's usually when the poo's hard that they don't want to pass it. So how do we know if our child is constipated? So here we've got what we call our poo chart. You may well have seen these before. So constipation can start at any age, and it's vital that it's not left untreated. So what we would say if a child did come along and see us, that we would expect type 4 is what we would be looking at for the type of poo. So some children absolutely love this, some are horrified by it, but some might like to look at it and tell you what theirs was like. But we would expect a number 4 at least 4 times a week. Other signs of constipation that you might want to look out for are large stools or just rabbit droppings. And the rabbit droppings, as you can see on type 1 here, might be that small parts of the big mass of the poo might just be falling off and coming away. Sometimes you can tell by a child's posture. They might start to stand on their tiptoes, they might back arch, or they might stretch their legs because they're trying to hold the poo inside them. But you can obviously see by the posture of their body. They might pass wind that's really offensive and smelly. And sometimes they might soil that we've previously spoke about in their underwear because the poo is down in the bum. And it might just smear onto their underwear. And what we would recommend is that you take the child to the GP for further assessment. So how can we treat constipation? Ensure that the constipation is treated correctly. As you can see on this slide, we've got a link. This is an excellent link that shows lots of information. It's actually called the Poo Nurses, but this will explain about taking medication and also lots of information. It's definitely worth a look at. Talking to your child about what's happening, why it's happening, and sometimes the pictures that are on the Poo Nurses will help to show a younger child what's happening and why it's happening. Developing good toilet routines is vital throughout the whole thing of a toileting process. So some treatments that we might use are Movicol, which is a sachet that is dissolved in with water. It must be taken correctly. Sometimes the doses of Movicol can change. So it might be that they start on more doses to actually clear the main bulk that's in the bottom of the bowel out, and then you might go on to a maintenance dose. This must be issued by your GP or a specialist nurse. And they will explain to you exactly what they want you to do. And this will all incorporate with the good toileting routines that must go hand in hand with the treatment. So, developing good toileting routines. As you can see, we've got a picture here, and this is the good position on the toilet is so that the knees are higher than the hips, leaning slightly forward with their elbows on their knees. So just some tips here. Ensuring your child is correctly positioned on the toilet. Regular toileting. So what we say is that we've got a reflex in our body. When our stomach is stretched, so after we've eaten, this causes a contraction inside the intestine, giving you the urge that you need to go to the toilet to have a poo. This usually happens 15 to 20 minutes after eating a meal. So this is a good routine to get into, maybe after your evening meal, if a child is suffering with constipation or you're trying to establish a toileting routine. About 15 to 20 minutes, go and sit on the toilet because this is the ideal time that our body will be able to, we will be able to have a poo. Another tip that we might have for you is encouraging your child to use blowing exercises when sitting on the toilet. Sometimes a balloon or just the little blowers that we have in the bubbles can be great. We've talked to parents before about sometimes children don't want to sit on the toilet because they're too busy doing everything else, or they need to be off playing with something or doing something. So we've talked about having a little bag within the bathroom with age-appropriate toys. Ensuring that they feel relaxed. Again, it could have a balloon in it because the muscles that we use to blow the balloon or blow the thing within the bubbles is the same muscles that we would have for opening our bowels. We would encourage the young person to sit for at least 5 to 10 minutes because this is the optimum time for them to relax and the muscles to start to work for them to have a poo. And most importantly, lots and lots of praise. Even if we just get the young person onto the toilet and they just sit there for 1 minute and then we build it up gradually and gradually, just lots and lots of positive praise. That's brilliant that we've got you in the bathroom. That's brilliant that we've got you to sit on the toilet. Brilliant that you've blown the balloon. So lots of positive praise. Even if we don't get the full effect that they're having a poo on the toilet, just praise them for whatever that they do by getting into the bathroom. So, developing good toilet routines. Ensure your child is eating a healthy, well-balanced diet, that they're having regular meal times and drinks. As I've spoke about before, the bell is like a conveyor belt. So we need to keep that conveyor belt moving so that every time that we eat it, we start to form the poo and it goes along the conveyor belt. The muscles start to pull it across. Lots of plenty fresh fruit, vegetables, increasing fibre in diet. This will all allow the conveyor belt to keep going and the poo to come out soft. We could look at, just substituting things, maybe looking at Weetabix, whole wheat pasta, just trying to increase our fibre within our diet. So, fluid is also a massive part of preventing constipation, ensuring your child has plenty of fluid throughout the day. And it's important that the drinks are spaced out throughout the day. So just as you can see here, we broke it down into 3 age brackets, 4 to 8 years, 9 to 13, and 14 to 18. And these are the ideal amounts of fluid that we will be looking at for a young person to be drinking. The more they drink, the better, because this will make the poo won't become dry inside them. It'll keep it nice and moist and soft. So we're going to move on to the next area now. My child will only poo in a nappy or a pull-up. Remember that a child who asks for a nappy or pull-up when they want to poo, they've recognised, they've got those signs, they understand that they need to go to the toilet and they need to have a poo. So that their body's been sent, that little message has gone up to their brain from their rectum because the poo's there, so they know what's happening. So first of all, we'll check for constipation because it may be that they just feel more comfortable with having the nappy on them or they've just got used to this. A way to start is to start, if the child is still in nappies, changing your child in the toilet or the bathroom when they ask for the nappy, so that they start to associate that room is somewhere that we go to when we need to have our bowels open. Involving them in wiping their bottom and emptying the nappy or the pull-up into the toilet. So this can eradicate the fear of what's going to happen to the poo, where's it going to go. So if they've done a poo in the nappy, you could even just take the nappy across to the toilet and get them to flush it away. Again, lots of positive praise. Tell them what's happened, we're going to flush it away now, we're going to wash our hands, make them part of that process. Encourage your child to sit on the toilet again 15 to 20 minutes after eating and use the blowing exercises. Using this as a stage approach, and as you can see, I've just spoke, so it's a general, even if the person doesn't want to go in the toilet, we just take them to the door. We might use a mat and use the mat gradually into the bathroom. It could be that they still need to poo in the nappy, but we change it in the bathroom. Getting them to just sit on the toilet, even with a nappy on, even if we can just get them to the toilet, that could be a massive hurdle that we've got over. Sometimes we've worked with young people where they won't poo without the nappy, but we've actually cut a hole in the back of the nappy, got them to sit on the toilet, so the poo comes through the nappy and into the toilet at the end. So it's a stage approach, and just making one little step towards them using the toilet is a massive thing, and each step can take it. There isn't a set amount of time. Every child is an individual, and you as a parent, you know them better. So it's just about working through the stages as and when they're ready to move on to the next one. So next one, my child has daytime wetting. So why does daytime wetting happen? There's some few things here that we're going to talk through. Your bladder is not big enough to hold onto your wee, so it leaks. Your bladder is big enough, but it may become twitchy and empties before it is full. It will sometimes tell you that it wants to empty when it's twitching, but you can't get to the toilet quick enough, so some of the wee leaks out. And sometimes our bodies don't receive those signals, so our bladder doesn't send a signal up to our brain to say that we need a wee. And sometimes this is usually quite indicative of younger children. Sometimes they're too busy, they forget, they might be playing, so they forget to go to the toilet, and they know they need to go to the toilet, but they're too involved in that play. So they've done it before they realise that they need to actually go. Again, this is about being just lots of reassuring that when they get to the toilet and they do it, then that's brilliant. Lots of positive praise again. So we're just going to look at a little bit of an anatomy here. So how does our body produce wee? So as you can see here, our body's way of getting rid of waste is through urine. So we need to empty and fill our bladder throughout the day. So just like any other muscle in our body, bladder muscles need to be exercised to keep them in top condition. As you can see, this weightlifter here, he's lifting his weight, so his muscles in his arms are going to get stronger and stronger and stronger, aren't they? So by stretching our bladder and filling it up with urine, that will get stronger and stronger, and it'll be able to hold it more. So the urine is stored within the bladder, and it's almost, if we think of the bladder, it's almost like a balloon. So we need that to get bigger and bigger and bigger, and the muscles to strengthen around it. So, and again, this is like the messages that we spoke about with the poo. It's like a telephone message coming from the bladder to our brain to say to us, right, we need to go to the toilet for a wee. And we need to educate our children to know that when they get that message up here, that telephone message from the bladder, they need to go to the toilet. So it's about setting a good routine in place. So what causes daytime wetting? So as I said here, there's lots of things already. So the most common cause is an overactive bladder. Constipation that we've already spoken about. So the bowel might be so full of poo that could squash onto the bladder, so forcing the wee out without us realising. Drinks, not drinking enough can cause us to have daytime wetting. So if our wee is dark, yellow and strong, it might be indicative that we might have a urine infection, or we're not drinking, we might be dehydrated. Also, what we drink is quite important. Anything that's fizzy or anything that's caffeine based can sometimes irritate bladders and make them quite twitchy, and that can cause some daytime wetting as well. As I've already spoken about infections, if you've got any indicators that we've got any infection, that could be a high temperature, pain, dark, offensive urine, we must go to the GP to get that ruled out, because that will need medical care. And not getting to the toilet in time. So as I've said to you before, young people might get so involved in play, and the bladder gets fuller and fuller and fuller of urine, but they're too busy doing what they're doing, that they've left it too long, that the bladder eventually leaks, and that's when we get some daytime wetting happening. So my child has daytime bladder problems. So what as a parent can we do? So we need to, if this is occurring, we would encourage you to take your child to the GP to rule out any underlying problems. Ensure your child is having the amount of fluid each day, which is what I've spoken about already, and you can look back at that on the slides, the amount for each age group. Make sure your child is reminded to empty their bladder regularly. What we say is between every 2 to 3 hours. And this is important when we're trying to establish a routine. So we could set a little reminder on a clock, or we could put any kind of just little alarm just to remind that every 2 hours they go and have a wee, and eventually our body will get into that routine. Making sure your child's comfortable on the toilet. If they're not comfortable, do they need any additional aids? Do they need to refer us for occupational therapy, or do they need something else? You know, that might be something that we could speak to the GP about, or it might just be a referral to another agency. If your child is constipated, it's ensure that the constipation is treated, because we must treat the constipation and get that out of sorted, and so the child can deal with it before we could go on to look at any bladder problems. As I've already said, the bowel might be so full of poo that it could be pushing onto the bladder. Avoiding drinks that contain caffeine. As I've said to you, there is some research shows that caffeine can cause the bladder to actually twitch. And that can cause the bladder not to be full, but some water to leak out, so we get some daytime. If symptoms persist after, or if you try all of these measures and we're getting no difference, these are still happening, it's important that you go back to your GP and discuss it with them. Ensure that you tell them what you've done, how you've changed things, what you've implemented, and just letting them know that things haven't changed even though I've tried all these measures. So, supporting my school-aged child. So this can be quite a daunting thing if your child is starting school or moving to a new school or starting at secondary school, and there's some concerns regarding toileting. It's important that you decide who you need to tell. And this can be in primary school. It must be vital that the class teacher knows. Within primary school, the child tends to have one teacher that's involved in their care. So they must know what's happening, and they must be part of your process that you're working through. If the child's getting the same instructions from both, then hopefully we'll get a better outcome for them. It might be that they might need a care plan in school, so that if your class teacher was off at that time, then everybody knows where you're going and what you're doing. This can be different in a secondary school. It might be that you need to speak to their head of year, who will disseminate the information to the people that need to know. Accessing the toilet and permission to leave the class. Again, this is vital importance that the teachers know, and communication is good. In secondary school, it might be that the young person needs a toilet pass. This doesn't mean that it's going to say toilet pass. It might just be a red card or a green card, so that they know when the young person puts it on the desk, they need to go to the toilet and they need to go then. So again, if the teacher's aware of it in primary school, they should give the child the opportunity to go to the toilet as and when they need to go. Sometimes if you might be missing out on some parts of your lessons or your exams, encouraging the child to go to the toilet when they have the opportunity to go to the toilet. So at a break time, at lunchtime, afternoon break, just saying to them, make sure you try for the toilet, make sure you go to the toilet when you've got the break times. And sometimes with exams in secondary schools, there can be circumstances that the young person might be able to have their exam in a separate room that's close to the toilet, so that they can use the facilities without having the worry of walking through the hall and disturbing all the other children that are in there. Ensuring that your child's got everything that they need to school to manage their problem. That they've got a change of a bag. They've got a bag that's got underwear in, maybe a change of clothes, and the bag is in an appropriate room. We don't want it maybe in the toilets that all the other children are going to use, so they're aware that this accident's happened. We all know that children can be cruel, so it might be more appropriately based, maybe in a medical room or somewhere that the child knows where that they are, that they can go and get them and go somewhere appropriate to change it. If they're coming home with it and it's dirty, then ensuring it goes back the next day. So if they do have a problem again the next day, they can deal with it in the same way. And there should be a member of staff that should be aware of it, so that they can support them to move the bag around if they have to move around the school. So getting help and support. So as I've said on the first slide, we do have a single point of access here at Harden Health Centre. The full address is there and our contact details. There are just some details here as well that are really useful. It's called the ERIC website that you can access. This has got lots of information. It's got a section for young people, teenagers and parents, and there's lots of different sections that you can access, you can look at. There's things you can download, there's things you can print off, so please feel free. And there's also some YouTube clips on there regarding pelvic floor exercises. If you do follow all the information off this PowerPoint and you still feel that you're not getting anywhere, then please do not hesitate to contact us. We can take referrals from GPs, anybody, we can take them from parents. It's a self-referral. So you can contact us, explain that you've completed this session and that you don't feel that you've seen any difference and you would like some further support, so just contact us on this number. Hope this has been useful, and as I said, please contact us on this number if you need any further help or support.